Smart Material Applications in Brain Cancer Treatment by Laura Mahanti. Brain cancer inflicts 3.5 per 100,000 people worldwide. 650 people are diagnosed with malignant brain tumors every day. Glioblastoma multiforme, or GBM, is the most common, with a survival rate of 1 to 2 years. Most tumors reoccur within 2 centimeters of the original tumor site. And cancer is the second highest cause of death, followed by heart disease. So for the problem statement, brain cancer is difficult to treat with conventional medicine due to 3 types of barrier. The first is the blood-brain barrier, and the second is the blood-brain tumor barrier, or BBTB. And the last is a relatively weak EPR effect, enhanced permeability retention effect. Treatment such as surgery can permanently damage the brain, and conventional medicines can lead to toxicity or ineffectiveness of the drug, causing harm to the patient. So smart materials can help with the blood-brain barrier and all the other barriers with brain cancer because they are nanocarriers and they are promising transporters of anti-cancer drugs to tumors by passive tissue targeting and active cellular targeting. So right here in this diagram right here, here is the blood vessel, and here are the drugs inside here. Here are the nanoparticles, and this area right here is the active targeting, where the drug itself attaches to the ligand, and the ligand acts as a lock and key mechanism for the drug to access inside the tumor cell. Whereas passive targeting heavily relies on the EPR effect. With most tumors, they do have high porosity, and it's easy for nanoparticles to penetrate. However, with brain cancer, that's not the case. It has a relatively weak EPR effect, so small particles are very difficult to penetrate through. So some advantages of smart materials include controlled drug release that reduces the toxicity in the patient, passive and active targeting at the tumor site, monoclonal antibodies that can bind to specific proteins in cancer cells so that the immune system can recognize and attack them. These antibodies stick to and block the signals from growth factor receptors overexpressed in the tumors. Inhibitors such as tyrosine kinase inhibitors are used to block signaling pathways involved in abnormal growth. Drug carriers not only deliver to the tumor site, but also protect the drug from premature degradation through the use of hydrophobic additives. And some performance characteristics for smart materials is improved delivery of poorly water-soluble drugs, targeted delivery of drugs in a cell at a specific site, co-delivery of 2 or more drugs or therapeutic modality or the combination of therapy, and visualization of sites of drug delivery by combining therapeutic agents and imaging modalities such as gold particles. So there are 5 particular nanoparticles used to treat brain cancer. The first one is polymer nanoparticles. They are natural or synthetic solid carriers that have an inner aqueous or oily core. They have good stability, and their surface modifications can be altered to accommodate for a better blood-brain barrier crossing. The sizes typically range from 10 to 1,000 nanometers. Lipid nanoparticles are solid lipid matrices stabilized by surfactants. The hydrophilic and lipophilic surfactants surrounding an oily core, they have low cytotoxicity and good stability. The size ranges from 10 to 1,000 nanometers. The last 3 are liposomes, micelles, and dendrimers. Liposomes are spherical vessels with an aqueous inner core enclosed by 1 or more phospholipid bilayers. It's easy to prepare, commercially available, and they're suitable for hydro and lipophilic drugs. Size ranges from 50 to 300 nanometers. Micelles contain an inner hydrophobic core with a hydrophilic shell, and they can entrap large amounts of drugs. Unfortunately, they are not that stable. And they're useful for non-water soluble drugs. Size ranges from 20 to 200 nanometers. Dendrimers are the last, and they're actually also the most functional. So with dendrimers, you have one or more central core from which highly branched polymeric molecules arise. They can be easily functionalized, and they're the most versatile nanocarrier. The size of these range from 2 to 15 nanometers. So these solute molecules have to find a transport mechanism so that they can move across the blood-brain barrier, and that's through diffusion. So there are many different types of transport. The first is the paracellular, which is not the most effective, but nonetheless it still exists. And that's when small water-soluble molecules simply diffuse through the tight junction, but not in any great extent. The next is transcellular, in which small lipid-soluble substances like alcohol or steroid hormones penetrate transcellularly by dissolving in the lipid plasma membrane. The next one is carrier-mediated transport. That involves the binding of solutes to the protein transporter on one side of the membrane, and it triggers a change in the protein. The next is the efflux pumps transporters, which extrudes the drugs from the brain when compounds need to be moved against a concentration gradient. The receptor-mediated transcytosis is when the ligand detaches from the receptors and crosses the BBB with acidification of endosomes. The last two is AMT, which stands for adsorptive-mediated transcytosis. It's triggered by an electrostatic interaction between a positive and negative charge on the plasma membrane surface. And most new drug technologies are based on AMT due to its high drug capacity load. So actually, this is the most common transport mechanism for most typical nanoparticle drugs. The cell-mediated transcytosis, or CMT, heavily relies on the immune cells, such as monocytes or macrophages, to cross the BBB. Unlike other transport methods that permit only solute molecules with specific properties, CMT can be used for most types of molecules, materials, as well as particulate carrier systems. So out of all the seven systems that I briefly described, the transport systems, they're listed right here. This is the paracellular, which is right here. And you have the transcellular, the transproteins, the efflux pumps. And then the most common right here is the AMT, which is right here. So that's just a image of what I just described. So in terms of performance characteristics of smart nanoparticles, size matters. Based on a study in 2014, particles of 30, 50, 70, and 100 nanometers were distributed comparably when the tumors were hyperpermeable. Unfortunately, with brain cancer, it is not permeable. So nanoparticles actually have to be smaller than 70 nanometers to accumulate efficiently inside the tumor. So the degree of accumulation of these particles are correlated with the tumor shrinking efficiency. So for future developments, in April of 2015, researchers from the Houston Methodist Hospital developed a prodrug called MPMUS, or MIPUS. This drug is non-toxic and inactive upon administration to the patient. Cancer genes, brain cancer genes in particular, have a specific enzyme called MAO-B that's overexpressed. It has 4 times this enzyme compared to normal cells. So scientists developed the MPMUS drug that is attracted to this particular enzyme, which the brain cancer cells have. So once it attaches to this, it destroys its mitochondrial DNA. So this prodrug is converted into a positive ion, and it essentially traps the drug inside the mitochondria where it attacks the mitochondrial DNA. This is toxic for the glioma cells, but not for the healthy cells. The results show that 90 to 95% of malignant glioma cells in mice were destroyed by MPMUS. It did not harm healthy brain cells. And the researchers reported that the toxicity in the healthy cells were at low concentrations of 180 micromolar. Due to the success, human trial is expected to begin in 2016. So from that paper, here is an image of what I just described. The mitochondrial membrane is the green, which is right here. And the MEPIS drug, the prodrug, is in yellow. And as you can see, the enzyme is in purple. The drug is attaching itself to this particular enzyme. And when that happens, it's actually destroying the mitochondrial DNA of the cell. So all cells, cancer cells, healthy cells, in order for it to reproduce, you need mitochondria. And if you destroy the mitochondria, then the cell is not able to reproduce. In this particular case, this SMART drug is only targeting specifically the cancer cells that have this overexpressed enzyme. So in summary, I talked about how nanoparticles are the most efficient way to destroy the brain tumors through passive and active targeting. Specific nanoparticles are used for glioma that include polymer conjugates, lipids, micelles, dendrimers, and liposomes. Transport methods of these nanoparticles include paratranscellular and transcellular diffusion. Brain tumors have a weak EPR effect, so the size of the nanoparticle matters. Research shows that the size should be less than 70 nanometers for brain tumors to have considerable accumulation of the drug onto the tumor site and retention in the blood supply. Future applications of SMART materials involve the use of mitochondrial gene therapy techniques to specifically target glioma cells with the use of the MAO-B enzymes and the MP-MUS prodrug. Here are all the references used for this presentation. That concludes my presentation. Thank you very much for watching.